Hi, and welcome to another episode of Healthy Perspectives. My name is Vernon Solomon. I've been meaning to talk to you about a sneaky disease culprit that can be a potentially serious condition. It can cause discomfort, severe disability, and perhaps even death. It's an ailment that afflicts many persons here in Antigua and Barbuda. That disease ailment? Asthma. Asthma is, in fact, a worldwide affliction. It is estimated that in some parts of the world, 1 to 10 to 1 in 12 persons suffers from it. Asthma is so non-discriminate, meaning it affects both young and old, male, female, whether you live in the city or in the country, whether you are a manual worker, an office worker, a healthcare provider, or a non-healthcare provider. But the thing is, despite its prevalence, asthma is still so misunderstood, especially by non-sufferers. Even asthmatics often do not understand what's happening to their own bodies. This in itself can create the anxiety that only aggravates the condition. I sat with Dr. Leslie Walwyn, a family practitioner. She explains to us what asthma actually is and gives advice as to how we might be able to manage it appropriately. It's hoped that our discussion will help asthmatics and non-asthmatics both have more clarity regarding this condition. And welcome back to another episode of Healthy Perspectives. We're talking about a subject that I actually hold dear to my heart as well. As a young person, I suffered with asthma, and I use that word suffered with as if it's gone away, but truth be told, and we have with us Dr. Leslie Walwyn, who's going to speak more on the subject actually of asthma. There are a lot of misconceptions when it comes to asthma. How do you get it? Is it an infection? Is it an allergy? And I would first like to ask you, Dr. Walwyn, to explain to us what asthma really is.
Okay, so asthma is a disease that affects our airways, so our lungs and our lower part of our respiratory tract. So we actually have this here. So we have our lungs here. If we opened our chest, these are the lungs. And if we strip away all of this spongy tissue that makes up our lungs, we get this, which is an upside down tree or respiratory tree. And asthma actually affects this part of our airways going down into the smaller parts. And it's a disease where the airways actually contract in response to something that bothers the airway from the environment. So it's a disease affected by the environment, and it's something that comes and goes. It's not a contagious disorder, so it's not an infection, although it can be triggered by an infection. One of the triggers for asthma to cause this clamping down of the airways can be caused by infections, can be caused by newly cut grass, something in the air. It can be caused by the pets that we have. But the main thing about asthma, it's not a one-time event. So the asthma diagnosis is usually made after the person, usually a child, comes over and over again with wheezing. So the wheezing is that sound that's made when the airway contracts. And the airway is actually contracting because your body thinks that whatever it is out there is dangerous and harmful, so it contracts and tries to protect itself from outside. But in contracting and clamping down, we have difficulty breathing and we suffer, like you said. Exactly. So you get that whole suffering problem that comes on, difficulty breathing. It's no longer clear, easy passage of airflow. It now makes a noise, which is the wheezing that we hear. And there's difficulty breathing, so that's the outcome.
You mentioned children. What is it that a parent, teacher, a grandparent, what is it that they look for in this child? Is it necessarily to say that they have to wait until they hear the wheezing to say something's wrong? Are there some early warning signs?
So, excellent question. Yes, there are early warning signs. The most common warning is a nighttime cough. So an annoying cough that keeps a child up or keeps mommy and daddy up. So the child might be sleeping through the cough. And often the child is usually tired. If the child is going to school, the child is often tired during school the next day because they're not getting a good night's sleep. So persistent nocturnal or nighttime cough is one of the most common presenting complaints that will present as asthma. So even sometimes you might bring your child to the doctor and the doctor doesn't hear any wheezing. The doctor should realize that something's wrong if the child is actually coughing at night, even though the exam is normal, and can consider the possible diagnosis of asthma then.
As far as it pertains to those environmental causes that may trigger this event, what are some of those specific environmental causes? Because it sounds like you're referring to allergies, or the child or the adult may be having an allergic reaction to something.
Right, so it is an allergic process actually that you're having in asthma. So when we have a runny nose, when we smell some annoying perfume and we have a runny nose, that's the allergic process occurring in the nose. When we get itchy eyes because of some other reason, it's happening there. But in the airway, we also get the draining of fluid like you're getting in the nose, but you're also getting the tightening of the muscles in the airway. So that's the second very important process that happens there, the clamping down of the airway. So the triggers that might happen, the most common ones are going to be something in the environment, pets, unclean toys. So a fuzzy toy that you have that you love as a child and you're clinging onto it, it's not regularly washed, the dust, and these little tiny microscopic bugs that live, not necessarily in this.
Hopefully they're not here.
But microscopic bugs that actually live in our furniture, in our sofas, and in our beds, and in our pillows, that actually release these proteins from their skin, and those are huge triggers. Cockroaches are triggers as well, paint, the carpeting, there's so many common triggers. So it's important for us to know the triggers if we are asthmatic, so that we can protect ourselves from those triggers. And that's one really important way that somebody living with asthma or a parent of a child with asthma can help to take control over the condition, by learning the triggers of that particular child, or of your own personal triggers, and then protecting yourself from them.
Do you think we take that for granted, or family members of an asthmatic take the fact that there are these things in the environment? Or is it sometimes just, oh, you just have a cold, it's you'll get over it? Or
I think a lot of it is education. So I think a lot of the times we simply just don't know. As people living with asthma or family members living with asthma, we don't know that there are certain triggers associated. So you'll have asthmatics who are smokers, or the parents are smokers, and they don't make the connection that my child wheezes every time I've been smoking, or they might smell it on my clothes. So education is a huge part that has to be played in letting, as physicians and healthcare workers, it's our responsibility to educate people living with asthma, and letting them know that, well, there are these triggers, and by merely making sure that you wipe down your fan, and learn certain other little simple things like temperature changes. So, stepping out first thing in the morning onto a cold floor can actually trigger an asthmatic attack. So that warm to cold or cold to warm sudden temperature change can trigger an asthma attack. So just understanding, we put on slippers and we take out the rugs from the bedrooms and remove carpets. Basic, simple things that we can do can actually make someone's life a lot more comfortable.
do you find that although we live in the climate in which we do, that there are certain times of year that a person or an asthmatic may have more of a problem than other times of the year?
Absolutely. So when our nights are colder, so a lot of asthma sufferers are people who only get asthma at the colder months of the year, so our wetter months of the year. Right. So coming on to November. So you'll have some people who are fine between April and October, but then come November, when it starts to get cooler, as much as it's just from 80-something degrees down to 70-plenty degrees, it makes a difference for a lot of people. And then the rainier months, the wetter it is, there are going to be more viruses around. I said earlier that viral and bacterial infections can certainly irritate the lining of the airway and trigger an asthma episode. So those are also reasons. So yeah, asthma definitely can be seasonal.
I've heard that person say that because of the expense associated with asthma, because obviously there's medication that's going to be involved with the treatment. Education then is going to be an instrumental part, because if you manage it early on, then that means the medication. Does that mean the person may eventually come off of medication?
Not necessarily. So unfortunately, everybody's different. So you have asthma and I have asthma. I might be a very, very sensitive person where there are about 10 or 11 things that really make me go zonkers. But for you, there might be just one or two things. So, and also how my body responds to staying away from the allergens, especially if I have other health issues, if I have eczema and if I have gastrointestinal issues and food allergies, and I have a very active immune system that's working against all sorts of things, and it's very paranoid and it's thinking that there's so many dangerous things around, when in truth and in fact there aren't, but my body doesn't understand that. So even if I do all that's good, it's certainly definitely making me healthier, but absolutely sometimes medication is necessary. Fortunately, we have, once you're a beneficiary at MBS, you can actually get medication at no price to you. It's interesting that you say, though, that asthma is expensive, because it's still expensive, even though medication is free, because it's expensive to me suffering from it. So if I take my child to the emergency room because I don't understand how to help to control my child's asthma, because I don't understand the medication, or I don't understand the triggers, or I don't understand how to alter the medication when I see my child's beginning to get sick, then that's time lost for me. I spend the whole night in the ER.
Yeah,
my child can't function the next day at school. I can't function at work. And that's expensive, not just to me, but to the country at large. There's that expense. Or if I as an adult have it and I suffer, that's missed time from work. That's lost income ultimately for somebody. So it is an expensive disease, and there are more and more people suffering from asthma every year. So
that's an interesting statement. There are more and more individuals that are, research is showing more people are beginning to develop
absolutely.
asthma. Is there
it's a global thing. Certainly people suffering from asthma, we know that it's not just that, well, the whole world, and definitely asthma has increased globally 50% over the past 10, 15 years. But besides that, we know that there are certain socioeconomic groups that are more susceptible to it. So I think it's the harder life is, the more at risk you are from suffering from it. I think the good thing is, though, is that we have the potential, because we do have access to the right medication, and we do potentially have access to education as well. So education is critical. Whether or not I take medication once a week or once a year for an asthma episode, education is critical. And then once I need medication, we have access to great medication here in Antigua, but we have to understand how to use it, when to use it, and be guided when I change it. I think there's still so much more to be done in terms of helping people to understand how to take it.
So going down that route with how and when to use it, where do I need to start? I have a child, or I'm the asthmatic. How do I regulate myself? How do I know when something's developing to say, okay, I need to take my medication now, or I need to speak with my physician in order to maybe change my dosage of medication?
Excellent.
What do I need to do then?
So first thing is what you said, you have to have a great relationship with your healthcare team. So don't be a hero, don't try and do this alone. Don't rely exclusively on going and dipping in some water or playing in a warm room. Establish a good relationship with your doctor, with your healthcare provider, and your healthcare team. That's the first thing. Make sure that your physician explains to you, takes the time to explain to you what the triggers of asthma are, and it's often some detective work. Certainly, for example, for my child, it was extremes of emotion. Okay. Only get an asthma episode when he cries. So you will learn what triggers your own asthma or your child's asthma as you go along, so that you can protect your child to some extent from the triggers. Right. Okay, and then once you know that, you'll have to work with your physician to know what medication you should be taking, how frequently you should be taking it. So for some of us, we only need what's called rescue medication, because that airway only clamps down probably once a week maximum, or twice a year. For those people, they don't necessarily need daily medication at all, not to protect them from their asthma anyway. But for others of us who are coming down with their airway gets tight 2, 3 times, 4 times a week, they don't sleep a good night because of their asthma, those people need daily medication. And then the dosing of that and the frequency of that also alters. And then there's so many different grades. Yeah. As to how to know how we can actually prevent us from getting worse, that's something we've also figured out as experts. We can now help to protect you, just in the same way that we can monitor your diabetes with a stick in the finger, or we can monitor your blood pressure by checking your pressure in your arm at home. We also now can actually test your airway function at home, so that you will know before your airway gets tight whether or not you're coming on with an asthma attack. So using the peak flow meter, which we have here conveniently,
Of
Sorry.
course.
Sorry. But you have a peak flow meter, and they're different types. This is
Right.
one type, but they can look in many different ways. But what it does is it helps the person living with asthma know what their standard lung function is when they're healthy. So before they actually feel their airway getting tight, usually a day or two before, the lung function starts to decrease before they even feel any symptoms. That's when, if they're doing their daily lung function or checking out their daily lung volume, they can actually assess, oh my gosh, it's beginning to drop. I've discussed this with my doctor. My doctor told me when it starts to drop, I need to alter that medication and take more puffs of this or that. And then hopefully we'll see the lung function improve again. And that protects me or prevents me from ending up in the ER and from staying away from work or from school.
In your practice here, do you find many persons using the peak flow meter?
No, because it's not the cheapest thing to use, and it takes a lot of education. Not too much education, but it does take some education. So the medication is easily available because there's no out-of-pocket expense, but the peak flow meters, unfortunately, is an out-of-pocket expense, and there is a barrier to that.
But as it pertains to education, fine, we need to know what our triggers are as far as environment is concerned, understanding the medication. But are there programs, is there something out there that persons need to involve themselves with on a routine basis to get this education?
There is an asthma awareness group. I'm not sure how functional it is right now, but there is an asthma awareness group that is geared towards educating people. Certainly they can speak with their healthcare providers. There should be information available in the emergency department at the Mount St. John's Hospital. Speak with your physician. The asthma awareness group, they should be able to call 481-6352
Okay.
and see if they could get further information about it.
If an individual, they're at home, can they, as far as programs are concerned, is it a matter of me as a parent keeping a diary of all of these things, laying it out? I appreciate and respect what you said also as far as having a solid relationship with the healthcare provider. Do we have that? Do enough persons suffering from asthma have that solid relationship with their healthcare providers to help them? Is our emergency department being overrun with situations that could have been avoided?
I hear you. I think there are the global initiative for asthma GINA, the global initiative for asthma. There are guidelines, international guidelines for asthma management, and ideally, with the current medication available, we should have few to no hospital emergency cases. That's how it should be. So if we are educated, if we do use the correct medication as we should not have as many. So if we are having many, and I don't know what the stats are, I don't know what they are like, but if we are having many, then we clearly need to do more. So what I can say to people living with asthma or people who are regularly taking their children up to the ER is that they need to do more with their clinic doctors or their family doctors to make sure that their children are appropriately managed. The counter side is that I think generally as a people we also are suspicious of medications, especially when we have a young child that is on medication or is being advised to be on medication long term. Parents might look at it very suspiciously and say, but I don't want my child to become dependent on this medication. Meanwhile, what they're really doing is harming the airway tree, and actually if it's not properly managed with time, there can be some permanent damage to the airway. So you don't want that to happen. So education
Ultimately
is key.
Because contrary to popular belief, you don't grow out of asthma, as the old adage.
Exactly. So the airways definitely get bigger, but that doesn't necessarily mean you're going to become less sensitive. So when I'm very tiny and I have small airways, chances of them clamping down and closing are much higher. The bigger I get and the more, my airways grow with me, then they can clamp but not cause the amount of distress as when I was physically smaller.
Right.
So you can outgrow it, at least temporarily, but you can have an insult when you're in your 60s, some mean virus or some medication for your blood pressure or your glaucoma that can bring down the whole wheezing one more time again. So education still
the key. Dr. Walwyn, we're going to take a quick break and we'll be right back with you. Thank you and welcome back. We're continuing our discussion with Dr. Walwyn, and I appreciate you very much for sitting and having this conversation with us. It's been very informative, but I say final question, but watch this lead into others. But what is it that you really think that our viewing public needs to be aware of as it pertains to asthma? I know it's the education, and I think both of us are very passionate over the fact that we need to educate the community more so about asthma, management of it, early detection, warning signs and such. But is there anything else that you think that our public needs to really be aware of as it pertains to asthma?
I think once we basically understand, first of all, that it's not something that can take the better of us. Once we know what to do, knowledge is power. Once we know what to do, it is actually a disease that we can control for 99% of us. We should never be ashamed of the fact that we have asthma or that it runs in our family. There are world-renowned athletes, world leaders that are asthmatic and function beautifully with it. I've had patients who are prevented from exercising in school or participating in any physical activity, which scares me, because they're asthmatic.
Okay.
I mean, and there is exercise-induced asthma,
Of
because
course.
once I'm physically active, that's when I start to cough. But, you know, with education, we can understand that we can take medication before, a few minutes before, and run the race. It's all quite doable. So don't be ashamed. Seek out knowledge. I think that's important. It would be lovely if we did have a reliable source of information that we could always go to and get, so that we know how to take medication, because there are ways of how to take medication. For example, you know, an inhaler and a peak flow meter on their own are useless to a small child.
Right.
A child wouldn't be able to know. So there are aids and adjuncts that we use to make sure that your child gets the right amount of medication. So you might have all the medication for your child, but because your child isn't taking it properly, or because you yourself aren't taking it properly, because you're so short of breath, you can't take in that full puff of medication, that if you knew what to do, or if you had the adjuncts, if you had an air chamber, you would do so much better. And then these are probably small things that are overlooked in our day-to-day care. So it would be nice if we had that kind of reference locally that we could go to, where you know that you understand and learn. Somebody has taken the time to educate you on how to take the medication, when to take the medication, to make sure that you know that you really, really, really have to keep your house extremely clean.
Yeah.
That there are protective things that we can put on our mattresses. There are dust mite protectors. It's just a special type of covering for your mattress and for your pillowcases. Wash your sheets in hot water once a week at very least. There's so many basic little things that you can do to keep the asthma under perfect control, under great control, so that you never have to go to the emergency department. Wouldn't that be a lovely day when we never have to go back
I think
to
we're
the
all looking for that
emergency?
day.
Right, yeah.
And again, it goes back to that education, that word. I don't think we can
escape it, yeah.
enough.
Yeah.
Our culture, do you think culture plays a factor in it, as far as the level of importance that we place on this disease or many other diseases that are out there?
That's a great question. I think nationally, clearly, asthma has gotten its level of importance, because it's one of the diseases covered by MBS. So it clearly has that importance from a national perspective, guaranteed. I think as a people, we are probably overly suspicious of prescription medication. I don't know why, because there is nothing here of this earth that is not of this earth. So
Exactly.
you can say something is natural or not natural. Bottom line is, I want to make sure that my child is healthy.
Right.
There is no asthma medication that my child will begin to be addicted to. So there's no such thing as dependency on asthma medication, but certainly it will help to keep my child alive. Right. There, of course, are side effects, and learn the side effects, understand the side effects, and watch out for them. And of course, when you're getting, the less controlled your child is, the stronger the medication, and the more you have to be worried about side effects. Some of the medications you're on just to keep that child alive for the next few days. So it's not going to have any long-term harmful effects. I think we're so scared about the harmful effects, and we forget the good effect that this medication,
the immediate effect,
the immediate good effect this medication is having. So you have to sensibly weigh the pros and the cons of giving your child medication. That's a huge thing. And once we're educated then it's okay.
We talk about lifestyle so much on the program when it pertains to diabetes, exercise, all of these things, even when speaking about glaucoma and how lifestyle can ultimately affect whether or not we suffer and recognize early on about glaucoma. And even with asthma, and I'm glad you mentioned the exercise induced, because it's not a game ender. You can still lead a productive life with asthma. Absolutely. If we just take certain things into consideration.
Absolutely.
And my life may not necessarily be like my neighbor or my cousin or my brother, but that's a life that that person has, and this is the lifestyle that I need to then
so I can still achieve optimal best health. Absolutely.
Exactly.
And you know, lifestyle goes beyond that. So taking care of myself, making sure that I eat sensibly, eat a diet rich in fruits and vegetables so I get my vitamin C. That's important because the vitamin C will keep away respiratory tract infections. Being overweight actually doesn't cause asthma, but it worsens asthma symptoms. So maintain a healthy weight, exercise that keeps the lungs nice, and it helps the function of the lungs to exercise and helps the circulatory system. So you can't separate lifestyle from asthma when it comes to doing the best for yourself.
Thank you so much.
Thank you.
I appreciate spending some time with you, and hopefully our viewers just as well benefited from our discussion today. I hope, again, as I say to all my guests, I hope this is not our last time, your last time here on Healthy Perspectives. I think there are a few more topics that we'll be able to discuss in the very near future.
Thanks for
Thank you very much. We'll be right back. While asthma is a complex disease, managed appropriately, asthma should not be a major concern. But for most people with asthma, proper management is considered too burdensome or just not considered at all. So emergency room visits and hospitalization rates continue to rise, and unfortunately, unnecessary asthma-related deaths occur. Living with asthma should not be a death sentence. It doesn't mean a person has to live a life of solitude, locked away from the rest of the world, nor a sedentary life with fear of playing sports and being physically active. Both the asthma sufferer and their family and friends must understand the importance of proper asthma management and trigger avoidance, and also to avoid the negativity. Family and friends would want to avoid negative comments such as, "Oh, just get it off your mind," or "You look fine to me, it's not as bad as you're making it seem." The negativity only adds stress and anxiety to the asthma sufferer, which ultimately triggers an attack. Asthma sufferers, learn to understand your affliction and that it can be managed. Avoiding the negativity, decreasing the stress and anxiety, all of these things would only make the problem worse. Take care of yourselves. We thank you for spending some time with us today and allowing us to share healthy perspectives with you. Be well, Antigua and Barbuda, and may your perspective always be a healthy one.
Healthy Perspectives, an AUA ABS initiative offering you a positive view on health.